As the Delta variant runs rampant, there's new concern the virus could once again attack some of the most vulnerable in our community.
WREG investigators in Lowe discovered some believe it's because some of the people paid to help protect seniors are refusing to get vaccinated.
This is the Bistro Cafe. It's our casual dining venue. Hello, Dr. Sutton.
From enjoying lunch with family and friends to gatherings in the theater, life is finally getting back to normal for residents at the Village at Germantown.
Dining together again. We have big events and parties. If employees are vaccinated, they don't have to wear a mask.
Nor do residents. This is on the independent living side of Village at Germantown. CEO Mike Kraft says thankfully some restrictions have been lifted in their nursing home too.
I think the vaccine is largely responsible for us being able to get back like we are. We got our first vaccine doses here in January. And within a couple of months, most people had been fully vaccinated.
By mid-July, 87% of the nursing home residents at the Village at Germantown were vaccinated, as well as 89% of healthcare workers. That's one of the highest employee vaccination rates in the state.
We had a lot of awareness campaigns leading up to the vaccine being available. Anytime I was able to get in front of our employees or the residents, I would promote it, talk about it's coming.
But a News Channel 3 review of federal data reveals hundreds of other nursing homes across the Mid-South have a much longer way to go in fully protecting its residents from COVID-19. Because while many of the seniors have gotten vaccinated, the workers caring for them have not.
You would think that people working in healthcare would have a greater sense of awareness and a greater sense of responsibility.
Out of more than 300 nursing homes across Tennessee, only 13 had staff vaccination rates of 75% or higher by July 4th. In Shelby County, only 3 of the county's 27 nursing homes met that mark. Whitehaven Community Living Center had the lowest percentage of fully vaccinated healthcare workers at just 24%. The facility reported just 19 of its 78 healthcare employees eligible to work that week had a completed vaccination. At Quince Nursing and Rehabilitation, where COVID killed 35 residents, the deadliest outbreak in the county, just 28% of healthcare workers were vaccinated by July 4th. The Highlands of Memphis Health and Rehab wasn't far behind at close to 30%. Dr. Stephen Threlkeld of Baptist Memphis says unvaccinated workers threaten to reverse all the progress made at nursing homes once ravaged by the pandemic.
The situation is not perfect. It can be damaged by people introducing the virus, and now we have the more contagious virus for that to increasingly potentially be a factor. So it's very important, I think, not just for the people that work at nursing homes to protect the folks that they're serving, the patients, but they need to protect themselves.
In Mississippi, a vaccinated resident died and 2 others were hospitalized after breakthrough cases at 2 nursing homes, one in Hattiesburg, the other nearby. State health officials confirmed they traced the outbreak back to an unvaccinated worker.
They are the population that might tend to have the least intense protection from a vaccine. Some of them have other medical problems, and just by virtue of age and immune senescence, they might have a less long-lasting response to a vaccine.
At the Village at Germantown, Kraft says workers and residents know if new cases arise, the privileges residents are now enjoying again could disappear.
My hopes are that conditions continue to improve, that we have no other infections here, and we can ultimately restore ourselves to totally normal.
Dr. Threlkeld says the reasons for vaccine hesitancy among healthcare workers mirrors the general population, lack of trust, fear. Meanwhile, there's been a big push from several medical organizations recommending required vaccinations for healthcare workers. I talked to a nursing home administrator who says he's all for it, but facilities risk losing employees in an industry that's already often understaffed. Zanetta Lowe, WREG, News Channel 3.
And we also looked at nursing homes in Mississippi and Arkansas and found some with staff vaccination rates only in the teens. There were also facilities with 100%, though, of the healthcare workers that had been vaccinated.
Now, you can check out an interactive map on our website. Just click on this story at WREG.com.